先生们、朋友们，大家下午好！欢迎参加中国世界卫生组织新型冠状病毒溯源研究联合专家组举办的新闻发布会。我是中国国家卫生健康委员会新闻发言人李峰。
Ladies and gentlemen, dear friends, good afternoon. Welcome to the press conference of Joint Expert Team of China WHO SARS-CoV-2 Origin Research. This is Li Feng, the spokesperson of China National Health Commission.
新冠肺炎疫情全球大流行以来，世界卫生组织积极推动抗击疫情国际合作。中国始终坚定支持世卫组织发挥全球抗疫领导作用。
Since COVID-19 became a global pandemic, WHO has been actively promoting the international cooperation in terms of the COVID-19 response. China has always been showing firm support to WHO in terms of unleashing the role of WHO in the leadership of the global COVID-19 response.
经双方协商一致，中国与世界卫生组织共同开展新冠病毒全球溯源研究中国部分工作。自2021年1月14日世卫组织国际专家抵达武汉以来，联合专家组从流行病学与世界卫生组织共同开展新冠病毒全球溯源研究中国部分工作。自2021年1月14日世卫组织国际专家抵达武汉以来，联合专家组从流行病学、分子学、动物与环境3方面入手，以视频会议、现场考察、座谈交流等形式开展系统研究。目前已按计划完成了在武汉的科学研究工作。
With the consensus based on two-side negotiation, China and WHO have conducted joint research of the SARS-CoV-2 global source tracing, including the China part. Since the arrival of international expert teams in Wuhan in January the 14th, 2021, the joint expert team has been working from 3 groups, respectively the group of epidemiology, molecular research, animal and environment. The experts have been working in the forms of video conferences, on-site interviews and visits, and also discussions. They have conducted systematic and full-fledged research. They have already concluded the China part of the source tracing in Wuhan, according to the original plan.
期间，中国国家卫生健康委员会主任马晓伟先生与世卫组织总干事谭德赛博士通电话，就病毒溯源科学合作交换了意见。
During this period, Mr. Ma Xiaowei, the Minister of China National Health Commission, has been discussing and having abundant communication with Dr. Tedros, the Director General of WHO, through telephone. They have fully exchanged their ideas in terms of the scientific cooperation in the origin source tracing.
今天的发布会由联合专家组外方组长、世卫组织食品安全专家皮特·本·安布雷克先生，专家组成员、分子流行病学小组组长玛丽昂·库普曼斯女士和中方组长清华大学梁万年先生共同出席。
For today's conference, we have the participants from the joint expert team, and they are Mr. Peter Ben Mbarak from WHO's food security expert, and also Madam Marianne Koopmans, the member of the joint expert team, and also the team leader of the molecular and epidemiological research group, and also Professor Liang Wanlian from Tsinghua University. He is the team leader of the Chinese team of the joint expert team.
他们将向大家介绍本次新冠病毒溯源联合研究的有关情况，并回答记者提问。发布会全程采用交传的方式，可以用中文或者英文提问。
The participants from the joint expert team are going to introduce to the public and to the press of the relevant situation of the SARS-CoV-2 origin tracing in China. And also they are going to answer your question. This press conference will have consecutive interpretation, so press can ask your question either in Chinese or in English.
首先，我们请中方组长梁万年先生介绍相关情况。
First, I would like to invite Professor Liang Wannian, the team leader from the Chinese side, to introduce the relevant achievements in this source tracing in Wuhan.
各位媒体朋友们，大家下午好。我代表联合专家组，就是中国世界卫生组织新冠肺炎溯情联合研究的专家组，简要的向大家汇报一下我们这次 溯源联合研究的关于研究的基本过程以及主要发现。那么，关于研究的一些基本结论和下一步的研究建议，等一会Peter Byrne博士将为大家作为介绍。
Dear friends from the press, good afternoon. On behalf of the team leader from the Chinese side of the China WHO Joint Expert Team of the SARS-CoV-2 origin research, I would like to give you a brief introduction of the major research process and also the key findings of our endeavor in our recent mission. As regards for the conclusions and future recommendations and plans, these two parts will be introduced by the team leader from the WHO experts team, Dr. Peter Byrne.
我们这次的联合研究是以世界卫生组织召集的 SARS 冠状病毒、新型冠状病毒全球溯源研究的中国部分。它是我们2021年1月到2月这一个阶段的主要研究，同时是基于全球和中国过去的科学家们 一些研究资料的综述和分析基础上所形成的研究报告。
This mission in Wuhan from January the 21 from January to February 2021 are based on the original mission that is convened by WHO in terms of the global source tracing research of the SARS-CoV-2. This part is the first part, China part. And also the joint research report is based on the relevant research crystallization from the Chinese and international scientists in the past. And also the literature review of the previous research and also the analysis will be also included in this joint report.
2020年5月，第73届世界卫生大会要求世界卫生组织总干事与合作伙伴一道查明引发新冠肺炎疫情的病毒人畜共患来源 及其传播给人的途径，这包括中间宿主可能发挥的作用。那么，这种溯源的目的是预防动物和人类被该病毒再次感染，避免形成新的人畜共患的宿主，以及降低人畜共患疾病出现和传播的 更大的风险。
In May 2020, the World Health Assembly requested the Director General of the World Health Organization to work with the partners to identify zoonotic source of SARS-CoV-2, the causative virus of Covid-19, and the route of its introduction to the human population, including the possible role of the intermediate hosts. The aim was to prevent reinfection with the virus in animals and humans and prevent the establishment of new zoonotic reservoirs, as well as to reduce further risk of emergence and transmission of zoonotic diseases.
2020年7月，世界卫生组织和中国着手开展病毒溯源研究的相关工作，商定工作任务决定，那么就是形成了 有关研究范围、主要指导原则和预期的主要成果等内容。工作任务 包括初期的一些短期研究。那么这个短期研究重点是为了更好地了解病毒如何引入，并在武汉市是如何传播的。世界卫生组织秘书处和中国政府共同商定成立了一个国际多学科的团队，设计、支持和开展了一系列的研究，那么以协助追踪新型冠状病毒的来源及其对人类的传播途径。联合国际团队的工作将为其他地区的溯源、全球的溯源奠定了基础。
In July 2020, WHO and China began the groundwork for the studies to identify the virus origins. The agreed terms of references, or TOR, defined the scope of the studies, the main guiding principles, and the main expected deliverables. These TORs envisage an initial phase of short-term studies to better understand how the virus might have been introduced and started to circulate in Wuhan. The WHO Secretariat and the Government of China together established an international multidisciplinary team to design, support and conduct these studies to contribute to the tracing of the origins of SARS-CoV-2 and the route of its transmission to human beings. The work of the joint international team will set the ground for origin tracing work elsewhere.
因此，全球溯源工作将不受任何地点的限制，随着证据的不断积累和科学假设的不断发展，全球溯源工作可能会在地域上也随之发生变化。研究总体结果和发现将有利于加强全球对新冠肺炎疫情及其有类似来源的新发人畜共患病的防范和有效应对。
The global origin tracing work would therefore not be bound to any location and may evolve geographically as evidence is generated and science-based hypotheses evolve. The overall results and findings would benefit improved global preparedness and response to SARS-CoV-2 and emerging zoonotic diseases of similar origin.
那么，联合国际研究团队有17名中方专家和17名来自于10个国家，就是其他的国家、世界卫生组织、世界动物卫生组织，以及全球疫情预警和反应网络合作伙伴的专家组成的联合研究团队。研究团队的研究在武汉，主要是2021年的1月14日至2月10日进行了现场的研究，为期总共是28天。
The joint international team comprised 17 Chinese experts and 17 international experts from 10 other countries. And also they represent WHO, World Organization of Animal Health, partners in the Global Outbreak Alert and Response Network. The joint study team was conducted over a 28-period research from January the 14th to February 10th, 2021 in Wuhan by having a lot of on-site research.
那么，联合研究团队就是分成为3个工作小组，对中国专家以及相关的研究领域，在前期的研究工作进行了回顾，并且共同的讨论。那么3个研究小组分别是流行病学小组、动物与环境溯源小组、分子流行病学和生物学溯源小组。
The team, through its 3 working groups, reviewed the progress made by Chinese experts in phase 1 studies in the areas of the following 3 parts: epidemiology, animals and environment, and molecular epidemiology and bioinformatics.
那么除了3个工作小组之外，我们的这个团队还听取了相关议题的一些详细介绍，那么并开展了一系列的现场访问和关键知情人的访谈。
In addition to the 3 working groups, the international team received detailed presentations on relevant topics to help inform its work and undertook a series of site visits and interviews with key informants.
那么下面我简要的介绍一下我们联合研究的结果。第一，关于分子流行病学的溯源研究结果。
Now I would like to give you a brief introduction of the key findings in our joint mission. The first part of my introduction will be the results of the molecular epidemiological study.
由于大多数的新型冠状病毒，不是冠状病毒，大多数的新型病毒都来源于动物，因此要了解导致病毒溢出和全球传播的过程，就需要深入了解动物宿主携带的病毒多样性及其演变，动物、环境和人类之间的相互作用，以及形成有效人传人的相关因素。
As most emergent viruses originate from animals, understanding the process that may lead to a spillover and global spread requires a deep analysis of both the diversity and evolution of viruses in an animal reservoir, the interactions between animals, their environment and humans, and the factors contributing to the efficient human-to-human transmission.
一般来说，能导致全球大流行的病毒一定是具备了高度适应人类环境的这种特征。这种适应可能是偶然获得的，也可能是通过多个步骤逐渐演变的，而且每个步骤都得益于自然的选择。
Generally speaking, a virus causing a global pandemic must be highly adaptive to human environments. Such adaptation may occur suddenly or may have evolved through multiple steps, with each step driven by natural selection.
因此，我们将新型冠状病毒的溯源工作重点放在了2个阶段。第一阶段是即病毒在发生人畜共患转移前的动物宿主，它是如何循环的。在这一进化过程当中，各种动物物种理论上说都可能成为保存宿主。
The search for the origins of SARS-CoV-2, therefore, needs to focus on 2 phases. The first phase involves viral circulation in animal hosts before zoonotic transfer. During this evolutionary process, various animal species may serve as reservoir hosts.
那么，新冠病毒的祖先株可能在其循环的过程当中获得了感染人类的能力。我们发现，与新冠病毒序列高度同源的病毒表明，新冠病毒可能源于人畜共患的传播，但其储存宿主有待进一步明确。
Progenitor strains of the SARS-CoV-2 may have acquired an increased ability to infect humans during their circulation. The discovery of viral sequences with high homology to SARS-CoV-2 suggests that SARS-CoV-2 may have originated from zoonotic transmission, but the reservoir hosts remain to be identified.
那么，第2阶段主要是研究发生人畜共患转移以后，新冠病毒在人传染过程当中的演变，这种动物到人的溢出的可能性，随着动物和人的接触的频率增加而增加。如果宿主中的病毒基因需要进一步适应， 以实现有效的传播，那么这种溢出现象可能就会要反复的发生。这种的早期溢出可能不会被发现，一旦具有大流行潜能的病毒发生了演化，即外溢，也就是溢出，就会使其扩散，而导致大量具有适应性变异的病毒在不同地域的人群中出现，引发大流行。
The second phase involved evolution of SARS-CoV-2 during its spread in human populations following zoonotic transfer. The likelihood of animal-human spillover increases with increased frequency intensity of animal and human contact. Spillovers may be occurring repeatedly if the genomic of the virus in the reservoir require further adaptation for efficient onward transmission. Such early spillovers may go undetected. Once viruses with pandemic potential evolve or spill over, this would enable their spread, resulting in substantial clusters of viruses with adaptive mutations in different geographical human populations, and hence causing the pandemic of COVID-19.
那么，迄今的一些研究证据表明，在蝙蝠和穿山甲中发现了与新冠病毒关系最密切的冠状病毒。样本病毒与冠状病毒的基因序列具有相似性，而且比较高的相似性，提示上述哺乳动物可能是导致新冠病毒肺炎，也就是新冠肺炎疫情这种病毒的是一种宿主。然而，到目前为止，从这两种物种中发现的病毒与新冠病毒的相似度都不足以使其成为新冠病毒的直接祖先。
Evidence from surveys and targeted studies so far have shown that coronaviruses most highly related to SARS-CoV-2 are to be found in bats and pangolins, suggesting these mammals may be the reservoir of the virus that causes COVID-19. On the basis of high similarity in sequences between the sampled viruses and SARS-CoV-2. However, the viruses identified so far from neither of these species are sufficiently similar to SARS-CoV-2 to serve as direct progenitor of the SARS-CoV-2.
除了这些发现，水貂和猫对新冠病毒的高度易感性也表明，可能还有其他动物物种是潜在的宿主，比如说鼬科和猫科类的动物，包括其他物种。那么将序列数据库中的数据与潜在宿主动物调查中的数据进行比较后，我们可以发现，这些可能的宿主物种的采用，也就是说在研究上还是有缺陷的，也是不足的。
In addition to these findings, the high susceptibility of mink and cats to SARS-CoV-2 suggests that there may be additional species of animals, for example, those belonging to mustelid or feline family, as well as other species that act as potential reservoir. Comparison of the data from sequence databases with those from surveys of potential reservoir species show that these possible reservoirs are massively undersampled, or this research is not adequate enough.
那么，专家团队审查了通过中国国家生物信息中心在其包含所有可用的冠状病毒序列和原数据的综合数据库中所收集到的数据。
The joint team reviewed the data collected through China National Center for Bioinformation in their integrated database, containing all the available coronavirus sequences and metadata.
那么，对于在中国武汉所发现的病例，将其数据与流行病学的背景相联系后， 选择了12月，就是2020年12月31号前发病的病例。那么分析研究结果显示，在暴露于华南市场的这个病例中，有几例病例的病毒基因组是相同的，这说明这些病例可能是母革聚集性病例群的一部分。
For the cases detected in Wuhan, China, data was linked with the epidemiological background to select samples from cases with illness onset before December 31st. The final analysis showed that several of the cases with exposure to Huanan market had identical virus genomes, suggesting this can be part of a cluster.
但数据也显示，武汉市大流行初期就已经存在了一定的病毒多样性，说明在华南市场群以外，还有未采样的传播链这种可能。从生肉暴露或毛皮动物暴露的流行病学参数来看，没有显示出明显的病例聚集现象。
However, the sequence data also show that some diversity of viruses was already present in the early phase of the pandemic in Wuhan, suggesting unsampled chains of transmission beyond the Huanan market cluster. There was no obvious clustering by the epidemiological parameters of raw meat exposure or exposure to fur animals.
那么，通过一些文献回顾，审查了已经发表的研究的文献中，来表明新冠病毒早期循环的一些数据。我们对不同国家的一些数据的研究发现，新冠病毒的循环可能比最初发现病例的时间早了几周，部分疑似阳性样本的检测时间，甚至呢是要早于这个一些相关的首发病例的报告。这也提示，不排除一些地区存在着漏诊的情况。
Finally, according to the relevant literature review concerning the research on the data, it suggests that early circulation of SARS-CoV-2 from unpublished studies was also a very important part of our review. These studies from different countries suggest that SARS-CoV-2 circulation preceding the initial detection of cases by several weeks. Some of the suspected positive samples were detected even earlier than the first case reported. This indicates the possibility of the missed reported circulation in other regions.
那么这些所谓的漏诊是和这个疾病和病毒的特征是有紧密关联的。这是我们通过全球的一些相关数据的分析，所得出来的一个基本的判断。
So this kind of omission of report of the cases or the underreporting of those kind of cases are highly related to the disease course and also the symptoms of those illness. So this is a basic judgment that we can achieve after the review of the global data and the relevant literature of the global research community.
关于流行病学溯源的一些结果，那么流感样疾病和严重急性呼吸道疾病监测，并结合适当的实验室确认，是衡量流感和其他呼吸道病毒对人群影响的标准的一些措施。为了确定新冠肺炎致病体在爆发前几个月对发病率可能产生的影响，研究团队对武汉的母医院类流感样病人的成人少年监测数据和湖北省母医院 SARI 监视数据进行了回顾。这个 SARI 就是严重急性呼吸道疾病的一个简称，进行了回顾。研究结果显示，2019年的下半年，武汉市未出现未被识别的一定规模的新冠肺炎病毒的循环。
The second part of my introduction will be the source tracing work conducted by the epidemiological group. Surveillance of influenza-like illness, or ILI, and severe acute respiratory illness, SARI, with appropriate laboratory confirmation is a standard measure of the impact of influenza and other respiratory viruses in the community. To determine the possible impact of mobility or the causative agent of COVID-19 in the month before the outbreak of COVID-19. Adult sentinel surveillance data from ILI from one hospital in Wuhan and SARI surveillance data from provincial hospital in Hubei province was reviewed. The full name for SARI is severe acute respiratory illness. The findings indicated that there is no substantial unrecognized circulation of SARS-CoV-2 in Wuhan during the latter part of 2019.
通过保存的实验室样本和其他资源的早期溯源工作，在对武汉市、湖北省其他地区及其他省份各医院保存的2019年下半年约4500余份的研究项目标本进行回顾性的检测，也未发现新型冠状病毒的存在。
In retrospective testing of a convenient subset of stored samples of more than 4,500 research project samples from the second half of 2019 stored at various hospitals in Wuhan, the rest of Hubei province and other provinces, no SARS-CoV-2 was identified.
对零售药店的退热药、感冒药和咳嗽药购买量进行分析，未能提供新冠病毒早期社会活动的有用信息。
Analysis of retail pharmacy for the purchase of the antipyretics, cold and cough medications have also been conducted, and it did not provide a useful indicator of early community SARS-CoV-2 activity.
2019年的7到12月期间，武汉市和湖北省除武汉外的其他城市，全死因和肺炎死亡监视数据未见死亡趋势出现意外波动的证据。
And also during the period of July to December 2019, we have conducted review of the surveillance data on all-cause mortality and pneumonia-specific mortality from Wuhan city and the rest of the Hubei province. It produced little evidence of substantial unexpected fluctuations in mortality that might suggest the occurrence of the transmission of the SARS-CoV-2.
不能提示2019年12月份以前发生了新冠肺炎在人群中的传播，无足够的证据来确定2019年12月前武汉市就有 SARS 病毒的传播。
There is no indication of the transmission of the SARS-CoV-2 in the population in the period before December 2019. There is not enough evidence either to determine whether SARS-CoV-2 infection had spread in Wuhan before December 2019.
那么我们对武汉市233家医疗机构2019年10月1号至12月10号因4种疾病或者症状，这4种的疾病或症状包括发热、急性呼吸道疾病、流感样疾病和不明原因肺炎，因这4种之一的症状或者疾病到医疗机构就诊的患者共7万多份病例进行了认真的搜索。
We have also conducted research among 233 health institutions in Wuhan by searching the records of 76,000 episodes presenting one of the 4 conditions, respectively fever, acute respiratory illness, influenza-like illness, and or unspecified pneumonia in the period of October the 1st to December the 10th, 2019.
那么同时呢，采集了一些病人的血样，进行相关的抗体检测，结果均为阴性。随后呢，又组织多学科的专家进行认真的研判排查，没有发现符合新冠肺炎病例的病例存在。
We have also reviewed the testing of the blood obtained from the relevant data bank and also test the antibodies in the blood samples. All were negative. And also, it was followed by the multidisciplinary clinical review of those cases, which determined that none were compatible with SARS-CoV-2 infection.
那么对2019年12月份疫情爆发前2个月内，武汉市其他潜在的病例进行回顾性搜数，也未发现有新冠病毒感染病例发生的证据。结合其他的监测数据，上述2个月内，武汉市发生新冠病毒肺炎感染，它的规模的可能性不大。
Retrospective search for potential earlier cases in Wuhan in the 2-month period prior to the outbreak in December 2019 has not revealed clear evidence of the occurrence of the clinical cases of the SARS-CoV-2 infection. Based on analysis of this and other surveillance data, it is considered unlikely that any substantial transmission of SARS-CoV-2 infection was occurring in Wuhan during those 2 months.
那么在2019年的12月，武汉市人群中发生了一定规模的新冠肺炎的感染传播，大多数的报告日期是在12月的下半个月。那么许多的早期病例与华南海鲜市场有关，就提示该市场可能是一个病毒传播的爆发点，是爆发点之一，我说。但在同一时期，传播也可能在武汉其他地方发生。
Substantial transmission of SARS-CoV-2 infection occurred in the population of Wuhan in December 2019, with most cases reported in the second half of that month. Many early reported cases were associated with Huanan market, indicating that it was one of the focus of the transmission. Nevertheless, transmission was also occurring elsewhere in Wuhan at the same time.
那么根据目前的资料，我们还无法确定新冠病毒是如何传入华南海鲜市场的。2019年12月，武汉市可能发生了感染的传播。这些
It is not possible on the basis of the current epidemiological information to determine how the SARS-CoV-2 was introduced into the Huanan market. Substantial transmission of SARS-CoV-2 infection occurred among the population of Wuhan in December 2019.
那么鉴于部分的早期病例与华南海鲜市场有关，也有部分病例与其他市场有关，还有部分病例与任何的一个市场都没有关系，所以我们初步的判定，华南海鲜市场很可能是一个病毒传播的爆发点，但同时，武汉其他地方似乎也有可能存在着传播现象。根据目前的资料， 无法来判定这个病毒是如何引入华南市场或其他市场的。
While some of the early cases had an association with the Huanan seafood market, others were associated with other markets, and other cases have no market association at all. It is likely that Huanan seafood market acted as a focus for transmission of the virus. But there are also transmission appearing to have the occurrence elsewhere in Wuhan at the same time. This is our basic judgment. It is not possible, on the basis of the current information, to determine how SARS-CoV-2 was introduced into the Huanan market.
关于动物和环境的溯源研究的情况。